afternoon, members of the media, and to Bermuda. Thank you for coming. I'm here today to let the people of Bermuda know that we are here to listen and that we have heard you. We know the concern of Bermudans and especially the residents of the east end of the island regarding the decision that was made by the Bermuda Hospital Board to close the urgent care clinic in St. David's. Good quality health care is important to all of us. More importantly, though, as we have taken a look at this particular situation, I, without a conscience, could not allow closure of the clinic without options. There will be no closure of the clinic without alternative options. This government has made a pledge to this country, and I've said it many times before, to leave no one behind, and that means everyone, including the people of St. David's and St. George's, who have traditionally, in many cases, been left behind in certain situations. As you know, I'm from St. David's and I grew up in St. David's. I know what it feels like to be forgotten. During the aftermath of the Hurricane Emily, many years ago, those who were around at that time would know that St. David's was left without power for weeks upon weeks, some even over a month without power. Having to go to work and seeing the rest of the island powered up, only to get home to have a bucket and dip water, and no lights, still using candles. I remember riding home with some of my friends at the time and wondering, well, why isn't anyone placing a priority on the East End? Well, today your government is here to restore that hope. I've said it before and you'll continue to hear me say and demonstrate it. We are all in this boat together. We are all our brother's keeper. Let me remind you, Bermuda, we have, as a government, inherited a mess. But this government is about finding solutions. And so at this time, as we continue on with this press conference, I will now ask the Minister of Health to tell you exactly how we're going to proceed from today. I leave you with this message from the Premier, that we know during these tough times, we're going to have to make some really tough decisions as we move forward. But we must, in our decision making, remember that we leave no one behind, whether they're from St. David's, St. George's, Somerset, Hamilton, you name it. We're in this boat together. And so with that in mind, I'd now like to turn it over to our Minister of Health. Pat?
Thank you, Mr. Premier, and good afternoon, ladies and gentlemen of the press, and thank you again for coming for this press conference. You know, this government's primary mission and priority is to ensure the safety and security of the people of Bermuda. Integral to this mission is the need to make sure that our healthcare system provides everyone with access to quality and good care. The decision by the Bermuda Hospitals Board to close the Foggo Urgent Care Center on November 29th challenges the tenets of this mission, and the public outcry that has followed in its wake reflects it. It also reflects the very difficult challenges we face as a community between meeting people's healthcare needs while doing so in ways that are financially sustainable. My colleagues and I have paid very close attention to what people have been saying about the planned closure of the clinic. We have listened to their concerns. We recognize their needs, and we understand their fears, particularly as they relate to the needs of the East End in the event of a natural disaster that cuts off access to medical and hospital-based resources. My ministerial statement of last Friday committed to finding a solution with or without Bermuda Hospitals Board intervention. As a result, and in consultation with my colleagues, I have today directed the Bermuda Hospitals Board to keep the Foggo Urgent Care Center open until an alternative plan is worked out that meets the needs of the people of the East End. We anticipate that no more than 6 months will be required to ensure that this plan is up and running. I want the people of the East End to rest assured that the facility will continue to be there for them until an acceptable and financially viable alternative arrangement is in place to meet their needs. We are going to make this situation work, notwithstanding the difficulties that have been faced in the financial constraints which we inherited. Thank you very much. I'm happy to take questions.
Minister, has your decision been made in part because of the information that's come to you recently that the Hospitals Board had a report for 2012 and 13 that showed they had in fact made money?
What's interesting is the information that was included in the report that was shown on the television expose, if you will call it, last night. That information was actually included in my ministerial statement. So the Hospitals Board had actually made me aware that year one, there was $109,000 or thereabouts loss. Year two, there was a $350,000 loss. Year three, there was 300 and some thousand, and year four, there was an upswing of $109,000, but it was before all of the charges for the cost center had been appended to that cost center. Because the last year of loss of 3 years in were unaudited, I could understand the decision of the BHB to indicate that notwithstanding the $100,000 that was showing as a surplus, and hopefully we won't call this a profit or a loss. It's actually a surplus or a deficit. But we would certainly understand the Hospitals Board being concerned because with the lack of audited financial statements, there's no way to tell whether that 300 and some thousand deficit from the year before, total deficit of some $700,000, whether those numbers were actually accurate.
Will the Hospitals Board now be responsible for funding the services that you are promising in your statement?
Yes, the Hospitals Board will be required to fund them. What will happen is the Hospitals Board are in very dire financial situation. They had made the initial decision, and with the numbers that had been provided to me, I supported the decision that they made, primarily because they needed to find ways to make the money work when they now are responsible for $40 million of initial payments for a balloon payment for the completion of the building and an ongoing $30 million per year to be paid to Paget Health Services for the new build. In addition to which, the existing building is facing serious structural problems, as is MWI. So when the hospital looked at all of the things that they were required to finance, they had to start making cuts somewhere, and this was one of the results. With that said, we have very carefully listened to people, and we have instructed them to reverse the decision. They will operate this at a loss. There is no question. It's not automatically going to make money for them while a new plan is being put in place, but we are more concerned about the people and the health care related to the people of the East End than we are with respect to a longer-term deficit that may be run by the BHB.
Yes, Minister. Your shadow, Zane De Silva, has said to deal with the loss of $250,000 or so, that would simply require, or that can be dealt with by referring more patients to Foggo, as little as 7 a day. And he said that would cure the situation, as well as putting the East End clinic there. Your reaction to that?
Let me say that as the opposition has spoken, there's some comment that they have made that actually is valuable to the process. I will never throw out the baby with the bathwater. And to the extent that the BHB can be forced to reevaluate their business plan while the situation is being determined, then I think that those are things that they will absolutely have to look at.
Let me just interject there as well. It's important that we be diligent. And after 10 months and looking at certain situations, we are faced with now some of these tough decisions as we move forward. It would have been prudent of our former government to have looked at these situations in prior times so that we aren't in this position today. We find ourselves in this position and the minister is looking for options, and we now will put those options before the hospital board and say you need to be looking at some of the options that are available to us. But we are in this position now. Let's move forward with solutions. I've heard a lot of conjecture going back and forth about this here, and it's important for the public to understand that one of the most important things we can do is talk to one another about how to find a way through this. I appreciate, and I don't think that the Sergeant of Arms of the House of Assembly, Mr. Fox, would have a challenge with this here, but he and I had a personal talk. We're both from St. David's. And I appreciated the time that he gave me to share how he felt about the situation, man to man. We need to have more dialogue about the way forward. And I believe that as we have more dialogue, we'll find solutions. We can get bantering back and forth about the politics over it and numbers. This is not about numbers. This is about finding a solution. And I believe that together we'll find a solution within the next couple of months to put in a proper plan that makes this work. The initial plan, it was never going to work. And so that's why we're in this position today. So as we move forward, this is about collaborating with, and I appreciate the opposition whip as well, and her forthrightness in getting involved in this. I appreciate the members of parliament that stand around me today from the East End coming together. How do we move forward with this situation?
Minister, you're a shadow, or rather, we keep hearing about the center operating at a loss, but your shadow has pointed out that the $250,000, for example, was not even a percent of the overall budget. And government's being accused of sort of cherry picking this one area to say, well, it's not making any money, it needs to shut down.
Okay, let me just highlight that when the original business plan was put together, it was predicated upon the government infusing between $910 and $950 some thousand every year just to make the facility break even. From the commencement of operations, not a dime was put in. So when you come 4 years down the road, you find that there's no money that, to help the thing to keep going. And, I can take the criticism. I don't have any issue taking the criticism that this is a decision we now have to make. But with that said, I can tell you that if the money had been put in according to the initial business plan, we would have been having a different discussion today.
Minister, thank you. Couple of questions. First of all, you say that the BHP is now going to be operating the centre at a loss, but you're more concerned about the health of the residents of the East End. Why didn't you take that position 3-4 weeks ago when it was announced that the BHP announced that it was going to close?
It's quite easy because as the information was made apparent to us, to me as we were discussing it, the types of clients, of patients that were seen at the East End were categorized as non-urgent, and that East End facility is not equipped, notwithstanding that it's called the Urgent Care Center, that it is not equipped to deal with life-threatening emergencies. And as a result, the information that came to me from the BHP in their evaluation of the statistics surrounding the people, the utilization, that information indicated that people people could go to KEMH or to their primary care physicians. And it was based on that it seemed to make eminent good sense to, when they said that they could not afford to run it, given that each visit was costing an average of $422 in the East End, when the same services were just under $300 at KEMH. So it was based on that. And with our commitment and our mandate to reduce the exponential rise in the cost of health care, I was left with not much option than to support that line of reasoning. And with that said, having seen the public outcry and recognizing how important it is to them to have something available, then I am not afraid to admit if I have to have a rethink in response to what people are demanding. That is what we do as a government.
And going back to the top-up grants, do you know, was it, I understand that this was just a proposal, the sort of 970-odd thousand that the government was going to pay to make sure that the facilities broke even every year. Was that a firm proposal? Was it a guarantee by the government at the time, or was it just something put forward by the BHB that it hoped the government would do? Did the government agree to it, or do you know why it wasn't paid?
No, it actually was a requirement. It was a proposal put forward by the BHB. It was not reduced to any government guarantee as such. It was a proposal put forward when they put their business case forward, and in fact, the resulting consideration was that the facility was not financially sustainable and hence ought not to have been opened in the first place. So those were the considering factors that the BHB put in place at the time, notwithstanding that the decision and the numbers didn't work and that it was indicated that it would not be financially viable. The government of the day chose to build it. And now that we have the facility, the people of the East End, and in fact people as far afield as Dockyard, go down to that facility to use it. Because of its lack of utilization, there are very few people using it, so the turnaround time is quite short. But if we represent the public, let's just say that we represent the public, and if decisions are made with which the public does not feel comfortable, we have a responsibility to evaluate an alternative and to ensure that we respond to the needs of the public, and this is what we are doing.
So in your dealings with the hospitals board since you became minister, were you aware of any negotiations with the board and the former government as to, were they sort of going to the government saying, look, we need this $1 million or every year, or if we don't get it, we could be forced to shut this facility down? Do you know if that was put to the last government?
I can't tell you the specific discussions between the previous board and the previous government, but I do know that the BHB will actually give their side of what they deem to be an appropriate response, and I think that they will probably appear in front of you at some point in time in the very near future to give you a little bit more information in terms of the decision-making process, the position in which they found themselves, and what led to their initial decision.
But had those monies been paid year after year since 2009?
I think we would
be under threat at the moment.
We would not be under threat. The institution would not be under threat at the moment, but would it have faced scrutiny in the absence, with money coming in? Would that have faced scrutiny in terms of what was efficacious to allow to continue? I think that we cannot just simply say that we can throw all kinds of money at any situation, because we don't have a never-ending pot of money, unfortunately.
Okay, final question.
Thank you.
Yes, James, got one more question. Yeah, I've only got one more question.
Could you comment on what happens after November 29th, what immediate measures you're going to put in place, such as, are you going to introduce diagnostics? Are you going to change the hours of the urgent care centre? And can you also comment on when the people of the East End may be likely to get an ambulance service, because that is something they're also commenting on?
Yes, actually, an ambulance service is something that has been requested, it's been asked for, and it's something that we have as a part of the contingency and the reevaluation plan going forward. In terms of whether, the hours will change or different services, I'm afraid that that is for the hospital's board to determine. The government does not run the hospital, and I think that that's important to make that distinction, that will be determined by the hospital's board as to what is viable and what is not.